And today's performance will be filled in by TinaHaney. On a side note, before I start, I'd like to say, with regards to those questions that were just answered by the group, I mean, we are kind of singing to the choir. So I would have expected most of you to say, yes, certainly nurses are active in telehealth. When we teach, however, at Old Dominion University, and we ask our students and our interprofessional teams whether they feel they would be using telehealth, and kind of what their interest and their comfort level is, the scores are much lower. So you are a unique group. You have bought into the idea of telehealth, and we're trying to really encourage all of our students to realize what telehealth can do for our patients. Allison, I had the privilege of serving as her advisor during her capstone. She'll be graduating in May. So I'm going to be presenting Allison's study, Caring for the Stroke Caregiver, Investigating a Telehealth Intervention. So I am going to channel Allison as we go forward. So Allison works at the University of Virginia, which most of you know has a very strong telehealth, telestroke presence. Allison's interest, however, was really more about the caregiver. And as we learned earlier today, caregivers, informal caregivers, are really the primary caregivers in healthcare right now, beyond nurses and physicians. So she wanted to determine the feasibility of communicating with these caregivers of the stroke survivors through telehealth once the patient had been discharged. Her outcomes were related to the telehealth visit, as well as the caregiver's satisfaction with this type of communication, and some other outcomes that I'm going to talk to you about in a moment. Realizing also that most of these patients are older, so we were quite curious as she started this research whether the older individual in a rural setting, one, would have access to broadband technology and could have this type of visit, and two, if they would be comfortable visiting with an individual distantly located via telehealth. Oh, alrighty, happy finger. So here are her evidence-based research questions as she went forward with her project. The first was, is there a difference between the telehealth intervention group and the usual care group related to their self-identified anxiety, their ability to care for not only themselves but to others? So she was looking at whether she could really keep their emotional health intact, and perception of emotional support. Realizing at University of Virginia, these individuals were traveling over 100 miles sometimes, and they were quite isolated when they returned to their home and didn't have family support. They were alone with their loved one that had suffered the stroke. And she wanted to know, too, were they satisfied with this type of telehealth visit? So she did have two groups. We have an intervention group and we have a control group. The intervention group, she has an N of 15 and the control 12. All of the caregivers needed to be an informal caregiver of a UVA stroke survivor. They could be either a hemorrhagic or thank you very much. They needed to be unpaid and untrained. They were family members typically. They needed to be 18 years or older, and because of the questionnaires, they needed to be able to read, write, and understand English. Exclusionary was not a stroke patient, a TIA, or an individual that had suffered a TIA. The patient itself. I'm going to take you back to the beginning of Allison's journey for a moment, because I'm sure she would have shared this with you. She wanted to kill me the day that I called her and said, I really want you to use the Promise Bank for your tools. And I don't know if any of you are familiar with the NIH Promise Bank tools. If you're not, look at them, Google them. They're reliable, they're valid. There is a huge data bank, and they're driven for patient and caregiver outcomes. And you can rest assured, if you use these tools, that you're going to have really nice publishable data. Allison initially was going to create her own surveys, and with some angst, we were able to strong-arm her into using the Promise, and I know that she would have shared this with you. She has a researcher-developed satisfaction tool for the telehealth intervention. So her telehealth intervention, one thing, because it went through the UVA IRB really very quickly and also the ODU IRB very quickly because she was meeting with the caregiver, not the patient. And one of the big things with telehealth is HIPAA. She did not need to use a HIPAA platform because she was meeting simply with the caregiver. And at the beginning of this intervention, she told them, this is about you. I'm here to support you. This is about how you're doing. This isn't about your loved one, and this isn't about your loved one's health. So her questions were really focused on the caregiver. She wanted to know first, how are you feeling today? How are you doing? How are you caring for yourself? Are you eating? Are you sleeping? Are you getting out? Are you able to go to the grocery store? She wanted to know where the stroke survivor was currently living. Were they at the home with this individual? Were they still in rehab? She then asked if they had any ongoing concerns or questions really about themselves. And then, is there anything that she could do to help them? Do these not sound like real humanistic, caring questions that often weren't asked of them when they came back to the visit with their patient or with their loved one? She didn't have any specific time limit for this visit, and it could vary anywhere from 5 minutes to over a half an hour. So she was available to them for with her time to support them. So interestingly, her outcomes didn't show a lot of improvement. She looked at pre-anxiety, post-anxiety, the ability to participate in the social roles, and the emotional support. And we've talked about this a lot, and there are a couple reasons. One is when you're going through your DMP project, it's fast and furious. So it's a 3-month intervention. So we argue that she needed some time series visits with these individuals, that perhaps there would have been greater improvement had she had a visit, and then another week visit, and then another week visit. Also, are they going to feel better? Their loved one has suffered a major stroke. Are they really going to feel better? So these are some of the questions that we ask ourselves in considering this study, and her N was relatively small. For all of us who do research, you know at the end of your study you think, oh my golly, I really wish I had asked this question, or I wish I had changed this or done this differently. She found 2 things out throughout the study that she really didn't expect. A lot of these stroke survivors were dying. So these patients were dropped, or the caregivers were dropped from the study when their loved one passed away. And in retrospect, we wished we had left these individuals, had written into the study that they would stay in, because they needed as much support, if not more, than the person who was still caring for their loved one. So nurses' role in developing new models of telehealth. Some of the things we realized was this wasn't difficult. It didn't take a lot of time out of her day. It wasn't a hard program to set up. We can do many of these visits through our phones, our mobile applications, through computers and tablets. Any age can be involved. She had patients up into their 70s that readily embraced this form of technology. Don't rule out the older populations for support. If you think it, you can make it happen. We've had some fabulous talks this morning. I encourage all of you to, if it's your baby, go forward with it. Phone calls are a good form of communication, but it was better they saw each other. And that's the human factor. It's not, you miss a lot when you're on the phone with somebody or you're sending a text. They could see each other's expressions, and they could see her empathy. She was able to display her concern for these individuals through her facial expressions. She also found through this study that she was having trouble getting these patients and caregivers back for follow-up, and that was kind of an unexpected outcome. So now Allison is looking at using telehealth for that follow-up visit. She had absolutely no idea when the study started that these individuals weren't coming back for that 3-month follow-up. So what better way to have a follow-up than through a telehealth visit where they're not having to travel that 100-mile distance.